Live, this is 24-hour News 8.
A deadly virus has found its way to the U.S. for the first time.
A man with MERS, or Middle East Respiratory Virus, flew to Chicago on April 24th. He then took a bus to Indiana, and tonight he's hospitalized in a bed in Munster. Now, we know that the virus can't be cured or vaccinated against, so how concerned should we be?
24 News 8's Danny Carlson is here with what local officials are saying tonight.
Well, first we want to give an update on that person who was diagnosed as having MERS, the first case here in the United States. We're told the man who tested positive is currently on oxygen, and doctors should know if he will survive the illness within the next 3 or 4 days. But we wanted to know, is the fact that this virus is in Indiana dangerous for us just one state away? Is this something people should be concerned about?
Well, I don't think that there's a need for widespread panic at this point.
Because while the disease is dangerous to humans,
The thing that I think is concerning about this virus, so while there have been not that many cases reported, the case fatality rate is quite high.
and there's really no way to treat it or vaccinate against it. Doctors can only treat patients' symptoms. Local health experts tell us the good news seems to be MERS is relatively difficult for people to get.
Flu is a far more effective virus for spreading person to person. Looking at just the small number of cases there have been in the Middle East, it doesn't lead us to think this is a highly contagious virus.
Good news, considering patient 0 was in Chicago's O'Hare Airport, one of the world's biggest, and then took a bus to northern Indiana.
The CDC seems to think that the risk of person-to-person transmission here was pretty low.
We're told research shows that since the virus first appeared in the Middle East 2 years ago, most of the spread has been between family members or between the infected and healthcare workers. What are the odds that this will turn into a big outbreak in the Midwest?
Very low. I think we all need to be aware of it, and certainly when we have shortness of breath and coughing and influenza-like symptoms, we should speak with our physician, and our physicians should be asking what your travel history is.
There is more of a risk to get the disease if you have traveled to the Arabian Peninsula in the Middle East. And the health department pointed out today that they do offer travel clinics where you can get vaccinations. We have a link to that on our website right now, withtv.com.
And so also what we're hearing, though, is that this is not easily transferable from human to human. So it sounds like it's coming from animals.
And that's, you know, it's such a new disease that they don't know things for sure right now, but they have found signs that, yes, this disease is present in camels, that this disease is present in bats. So right now they're still trying to figure it out, but it does appear to be animal to human transmission and then more difficult human to human.
So much more to track down, though.
Yeah, it seems exotic. You get on a plane, you come back home. It's not. It's right here.
And that's the thing. We're such a global world now that these diseases can travel, and the World Health Organization seems to have been thinking that it was when it was going to come here, not if.
Right. Thank you, Danny.